If it's happening in New York, New Jersey, or Long Island, hear about it with Joe Piscopo. Mornings, 6 to 10 on AM 970. The Answer.
Good morning. 742 with Joe Piscopo on the radio. AM 970, The Answer. Dr. Elena Frid, back by popular demand, board-certified neurologist and clinical neurophysiologist who specializes in infection-induced autoimmune disorders, which is huge. This is the 21st century medicine that everybody talks about. Dr. Elena, welcome back to the show.
Good morning, Joe. Happy to be here.
Thanks for coming back. People love listening to you because me being a hypochondriac, I'm in my absolute glory because I worry about everything. First of all, you were in Boston speaking. How did that go?
It was wonderful. So I was at an ILATS conference. It's an international conference for Lyme disease.
Wow.
And I gave a talk on autoimmune encephalitis, and people had so many questions. I was answering questions for an hour and a half.
Oh, my gosh.
Yeah, it was wonderful.
But so this is really an epidemic, this whole Lyme situation.
It is. It truly is.
And then you could get that blood test, and I'm telling you, listening, if you want to reach out to Dr. Elena Frid, we'll give you the information. But I worry about it. If you, like your kid, for example, has attention deficit, for example, and then that could be from Lyme, that could be from a vaccine. Can you do that with adults too? Can you take a blood test and see maybe as an adult you make the wrong decisions, like the wrong relation? We were talking before we were on there. The wrong relationships, pursuing the wrong things in life. Will the blood test determine that, my good doctor friend?
So we're not there yet in terms of advising you on
relationships. That's called a
relationships.
psychiatrist. You're right. That's what I do.
But in terms of the blood test, so there's various blood tests, including, I think what you're talking about is a couple of specialty blood tests that are available through a specialty laboratory such as Advanced Labs or IGeneX or Galaxy.
Exactly. I have to tell you, because I talked to a couple of docs when we go out and we socialize with your husband. Oh, and by the way, just as an aside, your kids are so cute. How old's the youngest one?
4.
God bless you, girl.
He thinks he's 1 day older than the older kid.
Yeah. He is so cute. And your husband was there. He and I chatting at the best time at the Rangers game, actually. And then Daniel, who just is a star. This kid's such a star. He keeps saying, "Can I get an X chair?" He's asking, "Could we advertise the X chair?" That was so cute.
I know. He keeps asking us too.
But I love that you can go and get this blood test. People aren't aware of this. You get this specialized blood test. I try to look at different parts. Now I'm in Hunterdon County, so I'm in the boondocks a little bit. But people don't do the blood test. Like, you have to get a special kit, do you? You do, yes. And many Lyme ILATS doctors or Lyme literate physicians that you can actually approach through ilats.org or globallymealliance.org will have that information about Lyme literate physicians. They would know how to order these specialty lab tests. And like you said, you need a specialty kit, and it's available for both children and adults. And that will determine whether Lyme caused something or, you keep saying, a vaccine, a bad vaccine. Something that could, is there anything else that would? So it can determine whether you have Lyme disease. It's a little bit more sensitive test than your regular blood work that a regular physician would run. And it can also determine other co-infections that are often a big issue in patients who have, I think we're going to jump into mental health issues, so go right ahead. I know, but it's true though, right? I mean, what you think, and we talked about this before, I want to talk about this new blood pressure situation, but on mental health, that's scary because it really just is something that people don't understand, that it could be from Lyme disease, it could be from tick bite or a vaccine or something else, and it's not. How can you possibly determine that? And our doctors as astute as you are in finding these problems? So I think I actually talk about this a lot with my colleagues who have a similar thought process that I do. And we all think that psychiatry and mental health in general is most likely going to change greatly over the next couple of years. Maybe in the next 10 to 20 years it will change significantly, because right now a lot of the times we're treating symptoms. And we're not really getting the underlying cause of the disease process is being ignored. We just either don't know about it or we don't look for it. And these issues of infections and autoimmune encephalitis can certainly present as neuropsychiatric symptoms.
And I know that we wanted to talk a little bit about kind of the aggression that's going on.
All the violence. This is mental illness. What's the red flag on this, Doc?
It's very difficult because we're all smarter in hindsight. Obviously, in these instances, there were red flags ahead of time. But how do you know if someone takes aggression out on their family member and then go and do mass murder? How do you make that connection? It's very, very difficult to determine that. It is being looked at by various people in terms of studies. And we are looking to see there's a phenomenon known as Flynn effect. I don't know if you've ever heard of this.
Something more I got to worry about? Flynn effect. What does that mean?
It means that when a country has a decline in infections, their citizens' intelligence rises, and in turn the citizens become more productive and less violent. And this is actually something I wrote a letter to Donald Trump about because of the pandemic of Lyme disease and because of all this aggression, wars that are going on, and just aggression in general that we have been seeing in the news recently. Do we need to look more at microbes kind of as the culprit to these issues?
Wow. Can you do that? And again, this is going to sound out there, but maybe everybody gets a blood test when they're born. Will you be able to determine if someone's going to, just flip out and be violent from a blood test at a very early age?
Right now, we don't have this technology. I think we do have... I think we can be going in that direction. There's not one specific blood test to determine aggression. I think that, over time you monitor these patients, and maybe, if you see that they're having a lot of mental health issues and spiraling out of control, then perhaps it's something that you want to look into further and look for encephalitis and look for infections in these patients.
Yeah. Hey, what about this front page of the New York Times and a host of other papers around the country, all focusing on new guidelines for high blood pressure, and apparently now millions of Americans who didn't have high blood pressure yesterday now have it. How could they change the numbers like that?
So it's so interesting. I did see that in the papers. This actually, a similar thing happened with diabetes. When I was in medical school. I remember specifically my professor telling us when we were in the classroom, saying that, really many more people have diabetes, but the healthcare is not able to sustain that. And so we've increased the numbers to diagnose people with diabetes so that less people are diagnosed. And when healthcare is ready for it, we'll lower the numbers. So this is something that in medicine, we have been taught about this. I've been taught in medical school that blood pressure above 120 over 80, is high. So this is, from a medical standpoint, this is not really front page news. But I guess for the layman people and for the general population, they should know the fact that if you have a persistent blood pressure above 120 over 80, if that can change the way your blood vessels would look like over time and can predispose you to strokes, heart attacks, kidney problems, peripheral vascular disease, and many other issues. So I understand where it's concerning and scary. I think physicians have been aware of this for many years. So your doctor is aware, and he's on top of it.
It's 130. Like 130, people say, well, 130 is not so bad, but now it's bad. You got to watch it.
Well, the recommendations are like they used to be, is basically diet and exercise to help lower your blood pressure if it is in that 120 to 140 range, which is what we've been recommending for many years for patients. So the recommendations have stayed the same. You need to control your blood pressure. It's very important. Not a one-time reading, but over time, if your blood pressure is persistently high, it can lead to significant diseases.
And most of the time it's genetic, isn't it?
It can be genetic. in many cases, but really body habitus, making sure if you lose about 10% of your weight, if you're having issues with diabetes, cholesterol, or high blood pressure, you will probably have a much better handle on these diseases.
I love it. Dr. Elena Frid. And where can we reach you, Doc?
ElenaFridMD.com.
ElenaFridMD.com. Great to see you.
Thanks so much.
for making the trek in all the way from Brooklyn. Now you're going back, to your office in Midtown.
I am. Treat that blood pressure.
God bless you. Thanks, Elena. Hey, Debbie Duhame.
If it's happening in New York, New Jersey, or Long Island, hear about it with Joe Piscopo. Mornings, 6 to 10 on AM 970. The Answer.